Hi. So as a continuation of the first video which I had done for fissure in ano, in this video I'll be continuing from that to the surgical treatment of fissure disease. So to understand the surgeries that is done for fissure, one should understand how the fissure happens. I have explained this in detail in my previous video, but I'll just briefly go through the process of formation of fissure, which in turn will help you understand how we surgically deal with the fissure. So fissure is a crack at the anoderm, that is at the anal verge, and it is an extremely painful condition, and it generally happens due to unnecessary straining while passing motions, or if the person is constipated or has hard stools. So this causes excessive pain, and as a reflex, the anal sphincter, that is the muscle that surrounds the anal verge, goes into a spasm, and this in turn results in more amount of constipation and difficulty in passing motion, because when the motion arrives at the anal verge, the muscle is supposed to relax so that the motion can be passed out of the body, but it fails to relax because of the pain. It goes into a spasm, and thus the patient still further struggles to pass motion, ending up causing more fissure and more pain, and then the cycle goes on. We have understood this in the previous video. So surgical treatment for fissure is mainly directed towards relieving this spasm. So the muscle that is responsible is called as an internal anal sphincter. It is a muscle that surrounds the anal verge. It is an involuntary muscle, and in order to relieve the spasm during surgery, we release this muscle. We partially cut this muscle. So that in turn makes the muscle weak, and the spasm goes away. So once the spasm goes away, so the patient becomes pain-free immediately. So this is the advantage of surgery, that the pain relief is immediately after the procedure. So once the spasm is negotiated, because you are cutting part of the internal sphincter, the vicious cycle is broken, and the motion starts passing more freely, and the fissure healing takes place. So this is the concept behind surgical treatment for fissure disease. Now there are various ways in which this particular surgery is done, and so I'll be discussing mainly two types of surgeries, that is the laser sphincterotomy and the standard sphincterotomy. So in laser sphincterotomy, just like in any other laser surgery like laser hemorrhoid surgery or laser pilonidal sinus surgery or a fistula surgery, a laser probe is used here. The principle of the surgery remains the same, that is the internal anal sphincter muscle is partially cut, but this time it is cut by using a laser. In the standard procedure, we dissect the part of internal anal sphincter and then release it. So these are the two ways in which the surgery can be performed. Now, what are the advantages of surgery over, let us say, the more non-surgical treatment, that is the conservative treatment? As I had discussed in the previous video, the conservative treatment, there is always a risk of recurrence of fissure. That is, the fissure may heal completely when you are taking the medicines, but as soon as you stop them, maybe in a few months time, you can again get the fissure problem. So it is a recurring problem when you are just depending on the medicines. But on the other hand, the surgery gives a much longer lasting relief from the problem. It may be in years to it may be in decades also. I would not say that it completely makes the recurrence 0%, because there is nothing like 0% in medicine, but it definitely gives a very, very long term good result from fissure, and patients won't develop fissure. Majority of the times will not have any fissure for the rest of their life. So this is the advantage of surgical treatment over medical treatment. The second important advantage is, if you are on medical treatment, it does take time for you to get relieved of pain. So it may take a week or so. Until then you will be suffering from pain, and then slowly you will find some improvement. But when you talk about surgery, the biggest advantage also is that the pain relief is immediate. That is, soon after surgery, by the next day, the patient is completely comfortable, and most of them have absolutely no pain. So these are the advantages of the fissure surgery over conservative treatment with medicines. Now, what are the disadvantages or drawbacks of the surgery? Generally, this surgery is an extremely safe procedure. It has very minimal complications. One of the common complications that we encounter is infection. So if a person has had fissure for a very long period of time and he has tried conservative management and then has failed and then comes for surgery, sometimes we end up noticing some kind of pus after surgery. So this happens in people who have chronic fissures. It is generally treated with antibiotics, does not need any surgical treatment, and most often it subsides. The second important doubt that most of the patients have is that when we are cutting the muscle that holds the anal verge, then do we end up losing control of the anal verge? That is there going to be any involuntary passage of gas or motion after surgery? That is, we are, let's say, in a public place and we end up passing motions in without our knowledge. So this problem is called as an incontinence, and this problem is one of the described complications of surgery, but the incidence is extremely less. The reason being that when we are dividing the internal anal sphincter, we divide it only partially, and it is very meticulously calculated and divided, so we don't overdo the procedure so that the person becomes incontinent. Secondly, internal anal sphincter is not the only muscle that controls your power of motions. It is also the external anal sphincter, which is the more stronger of the two. So considering these two, I personally feel this complication generally doesn't happen to patients because we are extremely careful when we are dividing the muscle. To summarize, surgical treatment of fissure is a gold standard. It's a well accepted treatment. It has a lot of advantages as compared to medical treatment. It can be done by a laser surgery. It can also be done by as a regular surgery, and it gives good results. It gives longer lasting results, and it has very minimum complications. So if a person has regularly been facing this problem, I think it is better to go for surgery, because it just makes your life much more easy, and you will have pain relief for a very long period of time after surgery. Sometimes it is even lifetime. Thank you.